We all know that feeling, right? Being swamped by information.
Mm.
But for doctors dealing with electronic medical records, it's more than just annoying.
Oh, absolutely. It's a daily battle.
Yeah, imagine trying to spot those crucial details, those little clues, in this massive digital file.
While the clock's ticking down for the next patient appointment.
Exactly. It's a real pressure cooker situation.
It really is. And think about just how much data we're talking about. A patient's whole health journey, digitally.
Years and years of notes.
Right. Subjective stuff, objective findings, lab results, just mountains of them, imaging reports, historical trends.
Wow.
And physicians are expected to somehow pull all that together, often in what, maybe 15 minutes for an outpatient visit?
It sounds almost impossible. Just an incredibly tight window.
It's a huge task, a really tough job.
And that's really where something like Citrus AI Clinic Assistant comes into the picture. It's trying to change how doctors get ready before they even see you.
It's about equipping them beforehand.
Like giving them a better lens, maybe.
Yeah.
To focus on what's actually important in your record while you're still, in the waiting room.
Precisely. The aim isn't just digging up the information, it's about getting real, actionable understanding from it.
So moving away from that last-minute scramble through files.
Exactly. Citrus AI is built to proactively give the doctor those key insights they need before that first crucial interaction.
Okay, so for our deep dive today, that's what we want to unpack. How does this system actually work? We're looking at an article by Dr. 𝗕𝗂𝘁𝗁. He's the Chief Medical Innovation Officer at VMLP-AI Healthcare.
Right, the one titled Revolutionizing Pre-Consultation Insight.
Yeah, that's the one. And there's an image, too, showing the workflow, which we'll touch on.
Okay.
So let's get right into it. This whole problem, data overload, not enough time, what does that actually look like day to day for a doctor?
Well, Dr. 𝗕𝗂𝘁's article really paints a picture of this paradox, almost.
A paradox, how so?
Because the amount of detail we can capture now in electronic medical records, the EMRs, is amazing in theory.
Yeah, you'd think more information is always better.
Right. You've got the patient's own words, the nuances of their experience, plus all the objective measurements from exams, super detailed test results, that long-term view.
It sounds incredibly rich. An unparalleled level of detail, like the article says.
It is. But then it becomes almost too much to handle easily.
That's the bottleneck, right? The sheer volume.
Exactly. The article really emphasizes how much time it traditionally takes for a doctor to manually sift through everything.
Just trying to find the important bits.
Yeah, separating the signal from the noise, and then you add the pressure of those back-to-back outpatient schedules.
Those really short appointment slots.
Right. Dr. 𝗕𝗂𝘁 points out, doctors often have just minutes. Minutes to grasp the current problem, put it in the context of the entire history, diagnose, and make a treatment plan.
Wow. When you lay it out like
The
that.
stakes are incredibly high when you're under that kind of time pressure with so much data.
Absolutely. Things can get missed.
Definitely. And Dr. 𝗕𝗂𝘁's article points straight at those risks, incomplete assessments because some key historical detail wasn't obvious right away.
Or starting investigations down the wrong track.
Exactly, because you lack that initial context. And, in the worst cases, the article mentions avoidable diagnostic errors. It's a really delicate balancing act for clinicians.
Okay, so that really sets the stage for the problem. Now, how does Citrus AI Clinic Assistant actually propose to fix this, or at least help?
The core idea is simple, really. Give physicians a head start.
Preemptive understanding, the article calls it.
Yeah, a preemptive grasp of the patient's medical story. Citrus AI is described as this AI-powered tool that lets doctors sort of talk to the patient's records.
While the patient is still waiting.
That's the key window, that pre-consultation time. It uses that time proactively.
So it's not like just pulling up a file and reading it. It's more interactive.
Much more. Dr. 𝗕𝗂𝘁 is clear this is way beyond just searching for keywords or looking at a list of documents. He calls it a conversational interface. It uses complex stuff, natural language processing, intelligent data summarization.
So the doctor can ask it questions, like they'd ask a colleague.
That's the idea. Instead of just typing search terms, they can ask real clinical questions.
That sounds much more natural, much more powerful for getting at the history. Can you give us some examples? Like, what kind of questions could a doctor ask?
Yeah, the article has some good ones. A doctor might ask, what's been the trend in this patient's blood pressure over the last year?
Okay, that requires looking at data points over time.
Right, or summarize all chest-related complaints in the past 6 months.
Pulling together different entries, maybe.
Exactly. Or even something like any red flags related to their recent MRI scan.
So Interpreting findings, too, not just listing them.
Yes. These aren't simple lookups. The system needs to understand the question's context and then pull together information from potentially lots of different places in the record.
Right, you can't just do a quick 𝗕𝗂 plus F for that kind of insight. The AI has to understand the relationships between things.
Precisely. It's built to distill both the hard numbers, the objective metrics like blood pressure trends,
And also the more subjective things, like patterns and symptoms.
yeah, from all the text notes and structured data in the EMR. Dr. 𝗕𝗂𝘁 says the goal is to deliver concise, clinically relevant insights.
Insights that would normally take a lot of manual digging.
A significant amount of time and effort, yeah. That manual review is what eats up so much pre-consultation time now.
And the image with the article, it kind of shows this flow, doesn't it?
It does.
You see the AI, the Citrus AI clinic assistant, sort of interacting with the patient's chart,
Extracting the key stuff.
getting those details and trends, and then giving that synthesized understanding to the doctor, all before the patient comes into the room.
Exactly. While the patient's still in the waiting area, the AI is doing that background work.
That pre-consultation insight, as the article calls it, that seems like the game changer.
It really is transformative. By the time the doctor walks into the exam room, they're starting from a completely different place, a much more informed baseline.
So what are the big clinical advantages Dr. 𝗕𝗂𝘁 outlines? What comes from having that head start?
Well, there are several. For me, one of the biggest is the doctor getting a kind of contextual timeline.
A timeline of what?
Of the patient's key symptoms, previous tests, investigations, having that overview before the conversation even starts.
That seems huge. And I think the article mentioned alerts, too.
Yes, flagging abnormal patterns or worrying trends. That feels like a really important safety net.
Absolutely.
And it also highlights the value of knowing about past treatments.
Yeah.
You know, what worked, what didn't.
So the doctor isn't starting from scratch with treatment ideas.
Right. It provides crucial context for current decisions. Plus, the AI can even prioritize information.
Prioritize. How?
Suggesting areas the doctor might want to focus on in their discussion with the patient based on the history. It guides the conversation.
It's almost like the AI does the initial homework, the deep dive into the record.
Yeah, freeing up the doctor.
So the doctor can focus more on the person in front of them, on the nuances of now and that human connection.
That's a great way to put it. And the article does mention the flip side, the benefit for the patient experience, which is critical.
How does it help the patient?
Well, Dr. 𝗕𝗂𝘁 emphasizes that when you, as a patient, feel your doctor already has a grasp of your history.
You feel heard, right?
Exactly. You feel acknowledged, valued. It helps build trust and rapport much faster because you don't have to recount your entire life story every single time.
Yeah, I can see that. Imagine the difference, realizing your doctor isn't just glancing at the file, but actually knows your background.
It could really change that dynamic in the room, build trust from the outset.
That makes total sense. Feeling understood is so basic to good care.
What about the doctors themselves, the clinicians? How does it impact them?
The article talks about reducing cognitive load, which is a huge deal in healthcare right now, with burnout being so high. Cognitive load. Just the mental effort of juggling all that information.
Precisely. By automating that initial information gathering and synthesis, doctors rely less on sheer memory.
Which can fail, especially when you're tired or rushed.
Right. And they're less likely to miss something important because of fatigue or distractions. It's about saving their mental energy for the complex thinking, the clinical reasoning, the planning.
I bet. I've heard doctors talk about spending hours after clinic just catching up on records.
Oh, yeah. Imagine getting some of that time back.
Okay, let's talk about efficiency then. How does a tool like this actually change the workflow, the time management in a clinic?
Dr. 𝗕𝗂𝘁's article is pretty clear here. Every minute a doctor spends digging through records manually.
Is time not spent with the patient?
Exactly. Time lost from direct care. Citrus AI aims to change that retrieval process into an intelligent dialogue, as he puts it.
An intelligent dialogue. I like that. And what does that lead to efficiency-wise?
Well, several things. One is potentially faster consultations.
Faster? Does that mean rushed?
No, and the article stresses this faster without sacrificing quality. The efficiency comes from being better prepared up front, not from cutting corners during the visit.
Okay, that's an important distinction. What else?
It could also mean fewer redundant tests.
Because the history is clearer.
Right. If the AI has synthesized the history well, you avoid ordering tests that were already done or ones that aren't likely to add much new information.
Which saves time, saves money, saves hassle for the patient too.
Absolutely. It has knock-on benefits.
And those efficiencies must help the clinic run smoother overall.
Definitely. And Dr. Qiutai also suggests it could lead to better diagnostic accuracy because of that fuller pre-consultation picture.
Makes sense.
And potentially smoother documentation and follow-up planning too, since the key info is already pulled together and organized.
The article uses this phrase, clinical co-pilot, to describe Citrus AI. Not just software, but a co-pilot. That's interesting.
It is a compelling analogy, isn't it?
Yeah. What's behind that description?
I think it speaks to how integrated it aims to be. It's not just a passive tool you look stuff up in.
It's more active.
Yeah, it actively helps in understanding the patient's story, highlighting what's most important. It changes how doctors engage with the data and maybe even with patients.
And there was another concept mentioned, democratizing insight. What does Dr. Qiutai mean by that?
The idea there, I think, is that it helps level the playing field a bit.
How so? Between different doctors?
Yeah. A more junior doctor, using the same AI insights as a senior consultant, might be able to make more informed decisions sooner. It could accelerate their clinical judgment.
I see. Giving everyone access to that deeper synthesis of the record.
Exactly. The article sums it up by saying it helps make sure that no patient's story gets buried in the noise.
Lost in that giant digital haystack we talked about earlier.
Precisely. The AI, the machine learning algorithms, they're trained to find those patterns, pull out the key info from all that text and data in the EMR.
Okay, so if we boil it down, the main idea, the core value of Citrus AI, seems to be making clinics work smarter.
Yeah, smarter and more effective.
By giving doctors this richer understanding of you, the patient, before you even start talking in the exam room.
That's it. It's about using AI to boost human intelligence, really.
Letting doctors focus on the human side.
Right, letting them focus on empathy, complex thinking, the actual interaction things only they can do.
It definitely makes you think about the bigger picture of AI in healthcare.
Mm-hmm.
For both us as patients and for the people providing the care.
What other possibilities could this kind of tech open up? Things we haven't even thought of yet.
It's a huge question. And it leads to that final thought, really.
Yeah.
As these AI tools get more and more integrated, woven into the daily workflows, how is that going to fundamentally change things?
You mean like the doctor-patient relationship itself?
Exactly. How will it reshape that relationship and just the way healthcare is delivered in the future?
It's definitely something to think about. A fascinating space to watch.
Absolutely. It's evolving so quickly.